Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. Kelly Tuttle spent 2 decades as a cardiology nurse practitioner before a traumatic brain injury completely changed the course of her life. Instead of walking away, she leaned in, turning her recovery into a platform of hope and practical strategies for others navigating life after brain injury. What I admire most about Kelly isn't just her clinical expertise or the book she's written. It's the way she bridges lived experience with medical practice, creating a connection with patients that only someone who has been there can offer. We talk about resilience, the power of support groups, and what it really means to adapt when the road doesn't look the way you planned. Whether you're a student worried about setbacks, a clinician rethinking how to meet patients where they are, or simply someone curious about the human side of medicine, you'll find wisdom here. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Kelly Tuttle. Kelly, thank you so much for taking the time tonight to join us on Shadow Me Next. You have an absolutely incredible story, and your story has turned into an incredible platform with amazing resources for people. So thanks for what you've already done, and thank you for joining us tonight.
Well, thank you for having me, Ashley. I'm excited about what we're going to be talking about.
Oh, it's a great conversation. And unfortunately, it stemmed from a situation that I would imagine was very chaotic and very traumatic and very scary for you. And we'll definitely talk about that. But before we do, I would love to hear how you ended up in medicine in the very first place before all of this.
Oh my goodness. So I was the child that had the teddy bear covered in Band-Aids and IV tubing with straws, and my mother couldn't keep tape and Band-Aids in the house. So from the very beginning, I always wanted to care, to be caring, either a doctor or a nurse. And I decided to go into nursing because it was so much more patient focused, intensive. And I absolutely loved it. And I was lucky to have the resources and the support to go into nursing school at 19 and to come out at age 22, 23. I graduated from California State University, Fresno for my undergraduate. And I had worked as a volunteer in the hospitals, just trying to build up my resume. There was a specific hospital in town that I wanted to work at. It was Valley Children's Hospital at the time. And so I started looking for jobs there, worked in medical records and so forth. And while I was in nursing school and then graduated to kind of a nursing student position where you kind of work like a certified nurse's assistant.
Mhm.
And did that until I graduated. And then it was a leadership type part of my program where I worked in the emergency room at Valley Children's Hospital as a student to get my foot in, let people know, who I was. And that baby step kind of trail opened up an opportunity to work at this hospital, which wasn't accepting new grads as
Wow.
RNs at the time. But because of my trickle effect into the company, I was able to land a RN job in the emergency room after I graduated. And, what I saw, what I witnessed was the transformation of healthcare from a healthcare business to a business model. And so this was in the early 90s. And so then I saw the transition from RNs to unlicensed personnel doing tasks.
Mm-hmm.
And so the RN positions were going away, and the nursing position wasn't valued. And at the same time, I saw the increased trend of people needing to use the emergency room as a clinic
Mm-hmm.
instead of seeing an outpatient provider. And so eventually we hired some nurse practitioners. And so they were in the fast track clinic, and I was inspired to become a nurse practitioner. And I did. I went to Gonzaga University in Spokane, Washington, and finished their family nurse practitioner program, got my master's in the nursing of science. And that's just kind of how my career transformed. And as a nurse practitioner, I got into a training position in cardiology doing stress testing. And from that, I expanded once I was in the with the company. My position at the time was part-time. I would volunteer and work at family medicine practice, emergency room, OBGYN, pediatrics, just to get this experience down. And then finally, the cardiology department said, hey, we need you to work full time. And so I worked as a cardiology nurse practitioner for 20 years total. And then I had my car accident and got passionate about neurology and the brain. And so I worked very hard for 2 years, going to seminars, doing CE courses, reading anything and everything about the brain, and then was able to beg and plead to get a training position as a nurse practitioner, which was really intensive. I followed a neurologist, for a year, just, learning about Parkinson's, multiple sclerosis, epilepsy, and trigeminal neuralgia. That's what we kind of managed at first as the nurse practitioners in the department. And then it expanded over time to VNS, the vagus nerve stimulation for controlling epilepsy. And that I really enjoyed doing that. And then we added stroke patients. And then as I was transitioning out into retirement, I was learning about managing headaches. So it's just a kind of transitioning, evolving job of new things, new opportunities.
It is an incredible story. I am blown away. And I think one of the most amazing things is you went from cardiology, which is one of the most difficult and most complicated and complex fields of medicine, had an accident, which we'll talk about, a major, major life change. And then you went into then another more difficult, more complex field of medicine, which you've described the transition. It is not just, hey, let me go pick up a new job. Let me get a new shift in neuro. You really had to train and train and train and learn. And like you mentioned, you were learning all the way up into retirement. And I think we can phrase medicine as being a career for a lifelong learner, and we can talk about that. But until we
Yeah.
really hear that from somebody who has legitimately proven that medicine is a journey of learning, truly, I don't think we can really grasp the full concept. So thank you for detailing all of that. Let's focus on your role in neurology as a neurology nurse practitioner. You talked about a lot of the different conditions that you guys worked with the most. What were some of, in your opinion, what were some of your favorite, just ones that you really enjoyed either treating or diagnosing or helping patients work through?
My favorite part was kind of like being the ambassador. And because I was a traumatic brain injury survivor, I had been there, done that, and had the t-shirt, right? But I wasn't telling my patients that. And I wasn't allowing, telling my employer. And so my favorite part of the job was I would work with patients with Parkinson's or multiple sclerosis, and even with some patients with epilepsy, they start to develop mild cognitive impairment. And so my favorite part was helping them cope with that because that was like my bag of tricks that I could share with them. And they would be really surprised. They're just like, oh my gosh, how do you know that? You're the first provider who understands me, who gets it. And so that was my favorite part of the
Yeah,
job.
absolutely. And one where your ability to relate to patients is not something perhaps that you would have necessarily chosen, the way that you were able to do that. But you've taken that situation and you were able to really positively impact so many of your patients. I would imagine. I would love to hear more about your situation after the TBI. I mean, you have written some of these incredible books, one called After the Crash, an ebook called Getting Back Behind the Wheel. I would imagine at a certain point after your accident, you thought, I can't do this. How am I supposed to do this? Tell me a little bit about how that felt, especially as a medical provider. Here at Shadow Me Next, we have a segment on the show called Quality Questions, which is where we discuss potential interview questions that you might hear on your pre-health interview. Kelly has talked a lot about TBI. Traumatic brain injury has changed the course of her career and her life. And I could imagine in an interview, someone asking you to describe a medical condition that you have heard about either on social media or within your own social circles. To tell them about it, what you know about it, perhaps any medicine that you might be aware of behind it, and why it matters socially right now, why you think it's a hot topic. TBI is one of these. I'd be interested to know what you would say. Keep in mind that there's more interview prep, such as mock interviews and personal statement review over on shadowmenext.com. There you'll find amazing resources to help you as you prepare to answer your own quality questions.
Right. So I had a mild to moderate concussion, and I had been taken off of work for 3 months to recover, and not initially, but eventually. And when it was time to go back to work after that 3 month period, the 2 weeks before you're like, really, I was just sweating it. I was like freaking out. I'm like, what does my brain need to be supported so I can continue to be a safe, efficient employee and productive employee? And, I read I had a couple of concussion books that were my companions during my healing. And I had online resources. Of course, I'd had my speech therapy paperwork and neurotherapy. And I just was looking at it. And at the time, I had a ton of neuro fatigue. And so my ability to read and memorize and learn, my time frame window was tiny. It was like 5 to 10 minute increments. And it was just really rough. And then when I went to work, and it was just trial by error and some mistakes. And when I say some mistakes, like I didn't realize I had irritability because of light sensitivity and sound sensitivity. I didn't realize I'd had some impulsiveness. And so I would talk over conversations and maybe say things I would normally not say
Mm-hmm,
in front
mm-hmm.
of people. And so when I decided to write my book, I wasn't going to write about my story because I didn't want to bore anybody. That's what I told my writing editors, my writing coaches. But they said, no, you got to share your story a little bit, a little bit. And I said, okay, because I want this
Mm-hmm.
book to go straight to the point of strategies and tools that a person can use to support their healing brain while that they're at work. I don't want to waste their energy, because I explained they may not have the energy or the visual ability, because you can get your vision processes knocked offline to read a story. Let's get to the point, facts, baby, facts. But anyway, so yeah, so my book was going to be a one-stop shop where someone could go and grab before heading to work to find strategies and tools they could use to support their healing brain while they went back to work and school.
It's incredible. I mean, I love the subtitle, How to Keep Your Job, Stay in School, and Live Life After a Brain Injury. And I think so often we hear about TBIs, traumatic brain injuries, and we think, oh, wow, how terrible. The recovery's got to be so hard. But a lot of times we skim over some of these concepts like, am I going to lose my job? Am I going to be able to
Yes.
go back to school? And so just the fact, like you said, just the fact that you get right into it, even in the title, and you
Mhm.
explained to these people, perhaps either they themselves have a TBI or they have a loved one with a TBI and they just want to relate. It brings up an interesting question. I just recently had my first support group experience. Actually, I was a lecturer for the support group for people with limb differences. So amputees. I was speaking as a derm PA. We were talking about skincare and wound healing. And it was an incredible experience being in a support group. And I was not a member, I was a guest. And it was a very cool thing. Tell me why this sense of community and the sense of support is so important and so healing for people who share a similar diagnosis, something like TBI.
Yes, I totally support groups, and I got to participate a couple times in a support group in my area,
Mm-hmm.
and it was so nice to meet with people who get it. And you also, when you attend those support groups, they tell you like the doctors to see.
Mm-hmm.
They share their strategies on how they cope with, like, say there was someone there who said, "Oh, I forgot to pick up my children." And everyone pipes in, "Oh, well, I use alarms and I do this, and that really helped me remember. And don't worry, it's not going to always be like this. It's going to get a little bit better." And so I'm really encouraging of all my followers and my readers to find their tribe, because no one understands having sound sensitivity or neurofatigue until you have it. And
Mm-hmm.
it's really important to be with people who understand and get you.
I love that. And it's what your book offers for these people. You know, it's even people who might not are comfortable speaking about it yet, or perhaps are not interested in really sharing their own story yet. Your book offers not only a supportive glimpse into the diagnosis, but actionable steps. You know, and then you also have this incredible journal titled My Brain Injury Recovery Journal. Tell us a little bit about this. Why is journaling so important in this in TBI recovery?
Oh, journaling is like really key. It offers a lot of ways to support your brain while you're healing. Okay, so one, as I'm sure you know, writing with your hand on paper helps with neuroplasticity,
Mm-hmm.
the remodeling of the brain, and reconnecting, creating connections to make up for the ones that have possibly been lost with that concussion because of the axon sharing that you have with concussions. And it is one of the things about being a traumatic brain injury survivor is you tend to stay in your head. And you don't want to stay in your head because inside your head is negative Nancy's and Bobby Bully, right? You want to get out of that house, right? So writing in your journal helps you kind of be in the present moment, thinking about writing, moving that pen, write down those thoughts. You know, what did negative Nancy say, and was it stupid, or was it something you should share with your talk therapist? Maybe
Mm-hmm.
you could share it with a friend, or you could just say, go, you know, what you feel about negative Nancy and leave it there in your journal. But it also helps you track your brain injury symptoms, what and helps you discover what makes them worse, what makes them better, what therapies you're trying out. Are they making you it
Mm.
helping you? Are they not helping you? Did this medication hurt help? Did it not? What were the side effects? Um, and then it also helps you on those like really bad days when you're so frustrated, you feel like you're never going to get better. And you can look back in your journal entry and see how far you've come. Because the first 2 years, you do see lots of leaps and bounds in your recovery. But after that, the improvements are more incremental and subtle. And if you're not journaling so you could see how far you've come, you're going to miss out on that.
That is a great example of how some of these healing processes end up unfolding. And it's not just TBI. This is a lot of things, right? And we can think about the two
Mhm.
steps forward, one step back, three steps forward, five steps back types of
Yes.
situations. But I love the idea of putting that in a journal because I would imagine, especially while recovering from a TBI, it's not just the concepts or the way that the concepts flow in the journal, but it could also be your handwriting. It could also be the way that you follow lines on pay. It can just be visual. You can visually
Hmm.
see the improvements of things. And how motivating, how motivating for somebody who is on a long journey, which a lot of these chronic conditions, a lot of them are. This is so interesting to me. Let's talk to students directly here, real quick. You have an absolutely incredible story, and there's a lot of things they can take away, a lot of lessons they can learn from you, even though they might not have a TBI or have experienced a concussion. For example, a lot of students fear failure or unexpected detours in their career path. That's a question I get a lot. Ashley, do you think I'm behind? Do you think I've derailed? What wisdom would you share with them about resilience and just pushing through?
Yeah, so I had this conversation with a medical assistant that I had used that I experienced in my past, and that was not to let a bump in the road be a mountain.
Mm-hmm.
And there's always a way around. So her bump in the road was a certain class that she was taking, and she failed it the second time. And she felt like that was it. She's never going to be a licensed vocational nurse. And I said, oh, no, 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 no. Find out, go contact the school counselor, find out which college, other schools accept transfer of classes. Go take that class at another place, another university, and you might have a better teacher that will speak to you and your learning, and then you could take the class and pass it and then move forward. And she did, and she moved forward and she became a licensed vocational nurse. So there are bumps in the road, but you don't have to sit there and hit your head against it. There are ways around it. And if you can't figure it out, ask. Just ask people around. What do you think? What can I do?
What fabulous advice. That was great. And I love it because I think so often, as a student, I'm imagining just the end goal, right? I need to pass this class. I need to pass this class so that wherever I'm applying, whenever they ask, "Hey, did you pass this class?" I can say yes. But what a fantastic story she has about resilience and tenacity and how she passed the class and the people that she talked to and the advice that they gave. It's just, it really is about the journey, not about the destination. And I know that's so cliche, but it's true. It's so much more
Yes.
interesting to talk about that journey, which is basically your whole story. And I just love it so much. Kelly, as we wrap up, tell us, we've talked a little bit about your book. Tell us, where can we find these amazing resources and how can we connect with you outside of this Shadow Me Next podcast?
I would definitely recommend people to go to my website at kellytuttle.org and check out all of my resources and what I have to offer. And yeah, sign up for my Substack, which is on my off my website. But see the other stuff that I'm up to. There, all the links are there.
Absolutely incredible, the resources that you are providing to so many people who not only have TBI, but people who have family members that have had this and people who are just more interested in learning about it. Kelly, thanks for sharing your story and thank you for everything that you have done.
Oh, thank you. And thank you for having me and getting the word out. I really appreciate it.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.